Today I will be demonstrating an insertion and irrigation of an NG tube. First, I would check my medical record and the physician's order for the type of tube to be placed and the tube purpose. Today we're going to be doing an NG tube for suctioning. So I would first walk into the room. Hi, my name is Brooke and I will be your nurse today. Can you tell me your name and your date of birth?
Jimmy Johnson, 9/4/84.
Alrighty, Mr. Johnson, very good. Everything matches with your wristband. I've assessed your chart. It says you don't have any allergies. Is this correct?
That is correct.
Okay, very good. So I'm going to assess your nares and your oral cavity. The doctor has ordered an NG tube for us to suction you today. So I'm going to be placing the NG tube in your left nostril, which I will measure. It's going to go from your the tip of your nose to your ear, down to your xiphoid process, right by your breastbone. Okay, and then I would mark that with tape. Alrighty, now I will apply my gloves. Which I put on about 100 times, so they're kind of hard to put on. Alrighty, so as I'm applying my clean gloves, I will just keep filming. I'm trying to put my gloves on. Okay, so now I'm going to dip my cord into some cold water to make it stiff, and then put it in the lubrication so it would be easier to slide down. So I'm going to extend your head backwards, Mr. Johnson, and insert the tube slowly through your nair. Okay. I'm going to check for coiling with my pen light. Everything looks good. Now if you can bend your head forward with your chin to your chest and drink the water, and as you swallow, I will advance the NG tube until placement has been met. Okay. Can you speak for me, Mr. Johnson?
Yeah.
Okay. Very good. I inspected the posterior pharynx, and the tube is not coiled. True placement for an NG tube would be X-ray. So I would have added this towel up. So now I'm going to add air to the syringe and listen for placement in the left epigastric region. Do my air. With my stethoscope for the swishing sound. Okay, very good. Heard that. Okay, and then next I would anchor the tube to the nose. In the Y shape. I'm going to fasten this rubber band so the patient won't be stiff and they can have movement. Place the rubber band on the tube and then pin it to patient's gown. Now I'm going to attach the NG tube to the suction source at a low intermittent setting and perform oral hygiene every 2 to 3 hours. I would then document the time of insertion, the nasogastric tube length, the size, the type of gastric tube that was inserted, the color and the consistency of the drainage, or the drainage, and the client's response to the treatment, how well they tolerated it, and the instructions that I gave to the client. I would use the intake and output record, and if the pH was tested, I would obtain the value on the pH, stomach acid content. Okay, just keep rolling because I'm going to do it all in one. So now I would come back and, hello, my name is Brooke. I heard you were having some problems with your NG tube. Can you verify your name and your date of birth?
Jimmy Johnson, 8494.
Alrighty, Mr. Johnson. We're going to irrigate your NG tube and see if we can alleviate some of that discomfort. I'm going to, the doctor has ordered for us to irrigate it. The client, you are still in a semi-high Fowler's position. I would apply my gloves. I'm going to disconnect the NG tube from the suction source, and I'm going to verify the placement of the NG tube using the 30 milliliter syringe, and I'm going to obtain the gastric acid secretions by aspiration. So I'm going to do an air bolus of 30 milliliters. I'm going to listen to in the left epigastric region and listen for the swishing sound. Okay, very good. Now I'm going to instill my 30 milliliters of water, my saline. Milliliters of saline. Instill that. And then I'm going to withdraw 30 milliliters back out. Discard my solution to my container. And then I will discard that, and I would reconnect my NG tube to the suction source to low intermittent, and then I would document the irrigation that I did, the type of amount of the irrigation that I collected, the difference in volume that was instilled versus withdrawn, any difficulty that the client had while irrigating, and the response of the client, and any teaching that I performed during irrigation.